This panel is entitled "Physician Leadership in the Public Square," and in some ways it follows from panel number 4, where we talked about free expression, which we sort of assume is a fundamental right. So the first question, if I maybe start with Dr. Atlas, and then we just go down the line, is how can physician autonomy be balanced with the need for standardized public health guidelines? And you could sort of think about times of crises like a pandemic, where public health guidelines, sort of become a little bit more heightened in terms of their importance. People are looking for direction. They don't know what to do. They're afraid. So how does one sort of balance, a clinical decision autonomy, the importance of that, and then some public pronouncements? Dr. Scott.
Okay, thank you. Yeah, I'm going to answer it this way. You're right. MDs particularly are in a special position in our society, and they are granted special respect by society. And that respect is trust. It's based on trust and following 2 assumptions: that doctors will use critical thinking, and that doctors will use an ethical compass when they talk to patients. The classic example that I can cite is off-label use of drugs. They have autonomy. 20 to 50%, depending on what you read, of drugs are prescribed off-label. That means they're FDA approved for something other than what the doctor's prescribing it for. And this is accepted by our society because it's based on that trust. The problem is that MDs are supposed to work by using facts and data. They are trusted to inform their patients. It's a very personal experience to talk to a patient. The patient relies on the doctor with what I would say is almost, until recently, blind trust. And that requires that doctors know the evidence for the guidelines. They can't just memorize the guidelines. They're going to be asked questions. They're not supposed to be advocates who repeat what they're told simply because that is the guideline. And I can tell you from personal experience of my wife, who has a different last name than I do, and so the doctors don't know she is at Stanford. She says, what's the data on the vaccine booster? There's no knowledge of that. What's the data on the mask usage for COVID? They don't have the answer to these very obvious questions. The second point I want to make about physicians and autonomy is the basis of ethical medical practice is informed consent, whether literally or figuratively speaking. It's not coercion. It's not forcing or persuading with pressure a patient to do something. That sort of ties in with this statement. Guidelines are guidelines. That's all they are in a free country. I call on doctors, know your place in a free society. In the United States during COVID, human rights were violated. Guaranteed freedoms were eliminated by decree. Children were sacrificed in terms of learning. They were used as shields with experimental drugs for a disease that healthy children have no significant risk for a serious outcome from. And the burden was shifted to the poor members of our country. And because of these, this was not done in the United States by doctors. And therefore, doctors failed. What's my evidence that doctors failed? This is the data on the trust of doctors. Remember, this is a field that basically public blindly trusted generally. Up until April 2020, the quote, trust a lot in terms of doctors and hospitals. Americans, 71.5%, trusted a lot. January 2024, 40%. That's a plummeting of trust. How many people in the United States rated the CDC and the FDA as excellent or good? These are the main public health agencies. The CDC in 2019, 2/3 of people. Same thing for FDA, rated excellent or good. In 2022, 40%, roughly. That's the biggest drop in trust in an agency of all the government agencies, including the IRS. I mean, that's a real statement. So